Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for Alberta. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Today, I want to provide an update on COVID-19 in our province over the weekend. I am pleased to say that there are currently 8,774 recovered cases in Alberta. However, the number of active cases has now risen to 1,430. We continue to identify high numbers of cases across the province. We identified 110 new cases on Friday, 103 on Saturday, and 91 on Sunday. Almost 28,000 tests have been conducted since Friday, meaning there have now been over 651,000 tests completed across the province. Currently, 88 people are in hospital, including 17 in intensive care. Sadly, I must report that 8 more Albertans have died. These deaths were all reported to Alberta Health since Friday, and all but one occurred in the last 4 days. This is obviously a heartbreaking number to report. We cannot forget that this virus can have severe and even fatal impacts on our health. I would like to extend my condolences to the family and friends of those who have lost loved ones, and my sympathies to those who have suffered severe complications during this pandemic. 5 of the deaths I'm reporting today occurred at the Good Samaritan Southgate Care Centre in Edmonton and were reported to Alberta Health over the weekend. There are now 78 cases linked to this outbreak, including 12 deaths. We are taking this outbreak very seriously. Local health officials have been working with the operator and have determined that additional supports are needed to protect residents and staff. As a result, late last week, Alberta Health Services took over day-to-day operations of the Southgate Care Centre. This move was not taken lightly, but will provide more supports to help improve outbreak control, ensure appropriate levels of staff are in place, as well as infection prevention and control measures to address the site's COVID-19 outbreak. I know that many families in and around Edmonton have been impacted by this outbreak. It is yet another example of COVID-19's ability to spread rapidly and of the devastating impact this virus can have on some of the most vulnerable members of our society. We all must take extra precautions any time we are going to be in contact with anyone who lives in a continuing care facility, who is over the age of 65, or who has underlying medical conditions. As we see in the case numbers, the curve is no longer flat in Alberta. We all need to assess our own lives for where we are at risk of spreading or contracting the virus. All of us can make changes to our daily routines to prevent the spread of COVID. For those who may be at higher risk of severe outcomes, we have created a new online risk assessment tool to help you identify your level of risk for severe outcomes and to guide your protection decisions. You'll find it on alberta.ca. While all of us need to regularly take actions to protect those around us, independent of our risk level, this tool will help Albertans understand their personal risk for severe outcomes should they become infected. This is something we have been asked for by Albertans who want to know which medical conditions are linked to the highest risk of severe outcomes. For everyone, independent of risk, if you are sick or concerned about being exposed, please get tested. For those who have been tested, many have asked if there is a quicker way to receive COVID-19 test results. There is good news on this front. Albertans can access their own health information through a secure online portal called My Health Records. This portal gives you a secure place to see your health information, including immunization records, prescribed medications, and lab test results, including COVID-19 test results. This is the fastest way to get your results as you can see them online as soon as they are available. I encourage Albertans to sign up for a free My Health Records account at alberta.ca/myhealthrecords. This is an easy proactive step you can take that can make things easier if you are tested and waiting for results in the future, and it has the added benefit of giving you access to other parts of your health record as well. In addition, we are working hard with Alberta Health Services to shorten the wait times between testing and results and to connect those who have COVID-19 or contacts of cases to our public health teams as quickly as possible. This will also help us bring our case numbers down by preventing onward spread of the virus. With the rise of cases in recent weeks, I know when I talk about statistics, we can forget that there are real people behind these numbers. It's important for us all to remember that these are real people who caught COVID-19 while simply living their lives. They went to gatherings at friends' houses for social connection, funerals to grieve the loss of loved ones, workplaces to support their families, and exercise classes for mental and physical health. There are powerful underpinnings to our actions that lead us to activities that provide benefits to us. People who catch COVID-19 aren't bad people, and at the same time, people who avoid COVID-19 exposure aren't fear-mongering. As much as possible, we need to support each other to meet our needs for human connection, meaningful employment, and access to basic requirements like food and shelter, while at the same time doing our best to also protect each other from the spread of infectious diseases like COVID. I know many are tired of hearing me say that COVID-19 is not over. Sometimes I'm tired of saying it. The truth is, though, that COVID-19 is still here. You may remember a few months ago I talked about COVID-19 as a wall of water heading towards us. Our public health measures are the barrier that keeps this wall from landing on us with full force. We can tolerate some gradual streams of cases as long as they stay gradual. What we need to prevent is a scenario where the breaches get so large that we become swamped with cases that overwhelm our system. This can happen quickly if we let our guard down. COVID is out there waiting for us to be too tired to wash our hands, too distracted to notice whether we are within 2 meters of someone else, too busy to stay home if we are feeling sick, or too polite to suggest we all bring our own food to a gathering. Our individual actions do not affect only ourselves. When we don't take simple, everyday precautions, we let one another down. When we have the mindset that the virus can't touch us, or if it does, all that matters is that we will personally recover, we let one another down. And that's not how Albertans are. We have shown time and again that we are here to lift one another up. It is within our control to get our case numbers moving in a positive direction. We can get back to where we were just a month ago when we moved forward with relaunch because our active case numbers were low. Every step we take as individuals to stop the spread is a step in the direction of health and safety for everyone. Continue to physically distance, practice good hand hygiene, wear masks if you are going to be in crowded places, and stay home when you are sick. I continue to encourage you to wear a non-medical mask anywhere it may be hard to stay 2 meters apart, especially in indoor spaces. This could be on a bus, in a mall, or during your trip to the grocery store. Many Albertans are wearing homemade and cloth masks, and I've enjoyed seeing the masks on Twitter on the hashtag Alberta Cares. I'd like to thank everyone who is doing this for making masks accessible and adding a sense of fun and creativity that I hope will encourage everyone to wear a mask every day when they're outside, their home, and in public places. I'd like to see more of the masks you have found that showcase your unique personality. Please show others your favorite mask by tweeting a picture and using the hashtag Alberta Cares. I've done that, and if you go to my account, you can see a picture of me wearing my favorite mask, one with the periodic table on it. While COVID-19 may be causing changes to our lives, they don't all have to be gloomy. When we can find creative ways to follow public health advice, keeping each other safe while having some fun, we should do that. We can turn this around. It is in our hands. Thank you, and I am happy to take any questions you may have.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
First is Kevin Nimick with CTV. Go ahead, Kevin. Hi, Dr. Hinshaw. Today we learned about more outbreaks at shops like Made by Marcus and Village Brewery in Calgary. Why are you not closing non-essential businesses to curb the spread? And are you weighing the economy over public health?
It's really important to remember that health is about more than the avoidance of COVID-19. And when we had a broad, widespread closure of businesses and other activities earlier this year, we did see impacts on people's health from isolation, from loss of employment. And as we look at our ability to move forward in ways that support all aspects of the health of Albertans, not just the prevention of COVID, we need to be able to balance those two things. Clearly, we need to be able to prevent spread of COVID. Clearly, we need to be able to have interactions in our society that enable us to have all those aspects that support our health. With respect to closing non-essential businesses, what we know is that the guidance that we've put forward in the public health measures that are in the guidance documents on BizConnect and on the Alberta website outline how businesses can stay open while taking measures to prevent the spread of disease. And what we are doing is working on a more assertive approach to reminding businesses of the need to follow that guidance, encouraging businesses to look again at the lists of things that they can do to keep their staff and patrons safe, and making sure that we're undertaking an approach to educate and remind business owners and those who operate activities. And if we continue to see spread and the measures that we're taking aren't sufficient and we are concerned about the possibility of overwhelming the system, we do have options available to us, but I believe that we can move forward successfully, again, with all of us pulling together to incorporate public health measures, and we will not have to close businesses if we can move forward again, implementing all of those measures while at the same time keeping those businesses open and operating.
Operator, can you put through the next caller, please?
That is James Keller with the Globe and Mail. Go ahead, James.
I've got a question about contact tracing apps. After some delays, the federal government's app seems to be getting closer to launch. It seems pretty clear it'll require participation from the provincial health departments. So can you confirm whether Alberta will participate and support the federal app? And when it launches, will the province still continue using AB Trace Together, or will you abandon that in favor of ensuring there's a single unified contact tracing app?
We're looking at multiple options with respect to contact tracing. And as you say, there is a federal app that's being developed. We also have AB Trace Together, and we continue to work on finding a solution to fix some of the issues, most notably the challenge with that app not currently functioning in the background on iPhones. So I would say that we need to look at whatever options we have on the table in front of us that can help with our response to give contacts the ability to find out as quickly as possible that they've been in contact with someone with COVID. And right now, again, we're just looking at every option we have. The advantage of the AB Trace Together app is that it has been deployed. It does work with our system. And so if we're able to get the fix with respect to having it function in the background for iPhones, that would be a very efficient way of enabling rapid contact tracing. So we are moving on that, looking at options for that. And of course, having conversations with the federal government as well.
Operator, can you put through the next one, please?
Next is Julia Wong with Global News. Go ahead, Julia.
What specifically led AHS to take over day-to-day operations of Good Samaritan Southgate, and what was happening at the site that led to that? Also, we continue to see a high number of cases identified in the province, and you've mentioned in the past that outbreaks would happen as the economy reopened and more people went out. But was the province too quick to reopen? And in retrospect, could waiting a few more weeks have prevented the rise in cases we're seeing now?
With respect to the Good Samaritan Southgate, the site did have a number of cases. There were several deaths that had been reported. And as is a part of our team's practice with respect to conducting audits. We have a compliance division at the ministry. There was an on-site inspection to determine if there was anything that could be, any additional supports that could be needed and how the functioning was happening. And so the results of that on-site visit determined that more supports were needed at the facility. And so that led to conversations with the operator, Alberta Health Services, to be able to move forward in a way that does support staff and residents in the facility to get the supports they need for all of their care, as well as bringing that outbreak under control. With respect to that question of the opening of the relaunch and the timing, it's important to remember that we, as I said earlier, all of us need many things to be healthy, and we did see the impacts of the closures that were in place on other aspects of people's health. So I think that there's no one perfect path through COVID-19 or through the pandemic, and I think all of us, each province, each country, is needing to make decisions to try to strike that right balance between protecting people from the spread of COVID, while at the same time providing all of the other supports and aspects of people's lives that are important to their health. And so I think there's no, again, one right way. And the important piece is that as we move forward, we're using the information that we have, we're using the evidence both from our own experience and other jurisdictions to continually make adjustments along the way. And I believe the guidance that we've provided and the framework within which businesses can operate, this can be done safely. We did anticipate that we would see some increase in cases with our reopening, which we are seeing. And I think at the moment, again, there are multiple reasons, but I think we are seeing that some people perhaps have inadvertently received the message that COVID is over, and we're just using this opportunity with our increased cases to remind people that COVID is not over. And in fact, our long-term success of relaunch depends on all of us going back to that guidance and each of us doing our best to prevent the spread.
Operator, can you put through the next question, please?
Next is Michael King with Global News. Go ahead, Michael.
Hi, Dr. Hinshaw. Besides the outbreaks listed on the website, where are we seeing the majority of cases come from? Any surprises where we think an activity is actually low risk, but it's actually being linked to a lot of cases? And then just on testing, early on in the pandemic, a couple of weeks in, the Premier was talking about running 20,000 tests a day. Why are we not even getting close to that?
With the first question, I wouldn't say we've had surprises. I think we've seen transmission happening in the kinds of activities that we have known were higher risk. Social activities, social gatherings, especially gatherings indoors where people are not distancing. We've seen high-intensity exercise classes, group exercise classes, that we've seen some transmission happening in those settings. And of course, we continue to have the challenges where there is introduction into long-term care facilities. Unfortunately, in some settings, we have seen wider spread. And again, every opportunity that we have to respond to these is an opportunity for us to learn and make our response that much better going forward. With respect to the volume of tests, we are working with Alberta Health Services to look at our current volume. And what I would say is that we had worked with our lab capacity to make sure that we were able to run tests through the lab and through the machinery. We also had been working with Alberta Health Services on assessment centres and swabbing capacity. And I think the important thing to know is that our priority has always been to make sure that those who have symptoms, those who are close contacts of cases, and those who are part of an outbreak setting have a test that is done as soon as possible, and that positive results are the ones that are fast-tracked as a priority for responding. So when people have a test done, those who have a negative test may need to wait a little longer before those who have a positive test. So we are dedicating our resources to those priority groups. And again, we are working on making sure that we can reduce the turnaround times for everyone, but it does take time. And so while our lab has been able to create that capacity, and that's some of what we had been speaking about earlier, there are other aspects of the system, such as the ability to get the swabs done, the ability to get the calls back to the individuals who have had a test done, that we are continually working on improving. And it is important to remember as well that as we have moved into relaunch, there are many other health services that had been paused that are now back online. And so health professionals who had previously been supporting different aspects of the response are needed in other areas of the health system. And so again, as with all parts of relaunch, it's a balance to make sure that we have the staff and the resources to support health needs of Albertans in all of those aspects of their lives. And again, we continually work to improve access to testing and shorten that turnaround time. But testing is only one aspect of our health system, and we are working to create that balance.
All right, I think we've got time for 3 more. Operator, could you put through the next question, please?
Matt Woodman with CBC. Go ahead, Matt.
Hi, Dr. Hinshaw. Over the weekend, the Premier shared an editorial written by Danielle Smith who points to Sweden as a guiding light for our back-to-school efforts. And in the article, there's a suggestion to, quote, let low-risk populations get the virus and develop a natural community immunity. Is this a strategy you endorse, and why or why not?
One of the challenges, you may recall, last Thursday I spoke a bit about the call to let the virus spread in some populations to develop that herd immunity. And one of the cautions that I would give is that we don't know a lot right now about long-term immunity that comes after someone is naturally infected with the virus. What we know from some of the early studies is that antibody levels seem to fall over time from people who've been infected with COVID, who have antibodies as a response, but then tracking them over time, those levels seem to fall. We don't know right now exactly what that means for long-term immunity. We also know that in those who have mild or potentially asymptomatic disease, they seem to have a more rapid fall in those antibody levels. And we know that children, for example, do tend to have milder or asymptomatic disease. So I think that it is too soon to be able to say that if those who are low risk, so for example, children, low risk of severe outcomes, if they get infected quickly, that it can provide population protection for the rest of the population through herd immunity. That is something that is not proven. We do not know whether or not there's long-term immunity from infection. And we also know that the more widespread infection is in a particular population, the more chances that individuals, even in populations that are at lower risk for severe outcomes, the more chance you have of a particular individual who's at higher risk getting that disease and then having hospitalization, ICU admission, or death. And with respect to Sweden, you've probably heard me speak about this before, that Sweden certainly, every country has had to make choices, and there's no one perfect way through this. And the approach that Sweden has taken has had a cost of higher deaths per capita than we have. I haven't run the numbers lately, but when we did the math a few months ago, it was a 12 times higher death rate than Alberta. So I think, again, there are costs to every decision, and there is no one easy way through this pandemic.
All right, operator, could you put through the second last question, please?
Dylan Short with the Edmonton Journal. Go ahead, Dylan.
Hi, Dr. Hinshaw. You said earlier that our curve is no longer flat, and we've heard that we would have to adjust our relaunch or reopening strategy as we move along. I was wondering if the fact that our curve is no longer flat is cause for concern about stepping back in the relaunch and potentially moving backwards a bit, and whether there's been any discussions around that topic at this time.
One of the things that we looked at when we were moving into relaunch was the metrics that we would be using to determine the timing of moving forward into additional opening stages, and potentially, again, that question of moving backwards. And some of the key metrics, while they are lagging metrics, they are the metrics that tell us how the health system is being impacted, are our hospitalization and ICU rates. One of the small pieces of good news today, I would say, is that our hospitalization and ICU numbers have dropped slightly since the report that I gave on Thursday. And so, again, I think that this is not a time to declare victory over COVID. This is going to be a long response for many months to come. but those particular metrics are not at a place where we would be looking at going backwards at this time. But again, we do see the higher daily cases. We've seen our overall trending going up with those higher daily cases. And so right now is a time, I think, to watch, to remind all Albertans, both those who are making decisions as individuals and those who are responsible for businesses or other activities, that in order to change the trend, we need to make sure we're following the public health guidance. So right now, again, is a time to do all that we can to encourage those public health measures to be utilized. So we're not going backwards right now, and we're also pausing and waiting to see how effective all of the work we're currently doing can be to turn this tide.
All right, operator, can you put through the final question, please?
Final question is from Rick Bell with the Calgary Sun. Go ahead, Rick.
Good afternoon, Dr. Hinshaw. Very soon here, Calgary City Council, as you know, will be passing a mask bylaw which will cover grocery stores, drugstores, shops, etc. But what is your message for places of business that are not covered by it, but people suspect are areas that are higher risk, such as packed bars, such as peddle pubs where people peddle a contraption? They're sitting right next to each other, they're drinking and yelling all at the same time. And so what are your thoughts on that? That there are these areas that I think everybody knows, high-volume bars that act like nightclubs, that are packed. They're not going to be covered by the mask bylaw. So how do they do their part in flattening the curve?
When the relaunch moved forward with respect to bars and restaurants in particular, the guidance around those particular places, and particularly for bars, was that bars could reopen with table service, with no more than 6 at a table, with no ordering at the bar. So people might be able to, for example, eat a meal while sitting at the bar, but they couldn't crowd around the bar to order drinks. And I think that in some locations, perhaps that guidance is not being followed, and our teams, we're having conversations with Alberta Health Services about our public health teams more proactively going into those places where we have seen and heard reports of that guidance not being followed, to remind them that this is not a time to have bars operating as they would have operated 6 months ago. This is a time to have bars operating more like restaurants, which was the premise under which they were permitted to reopen. Nightclubs, as you know, are not allowed to open. There's no dancing. There's not to be activities where people would be in close proximity to each other. So with respect to what part they have to play, it really is in following the guidance that's set out and reducing the likelihood that you could have widespread transmission in those locations. And we will be reminding those operators in various ways of the importance of them following that guidance.
Thank you all for joining us today. We will provide more updates online every day, and Dr. Hinshaw will provide her next update on Thursday. Thank you.